Hey there. So think about this. Millions of us take medicine every single day, right? We just trust that it's going to work. But have you ever really stopped and wondered how that trust is actually earned? It's not about slick marketing, I'll tell you that. It's all about some seriously rigorous science. And that's what we're going to dive into.
I mean, really, how do we know for sure that the little pill you're taking is actually going to do what the label says it will? It seems like a simple question, but wow, the answer is complex and honestly, pretty fascinating. This isn't about blind faith, it's about hard, documented proof. So let's pull back the curtain on the process that guarantees the quality of your medication. All right, so before you can even begin to trust a drug, you have to trust the scientific methods used to test it. It makes sense, right? This is where the whole foundation of safety gets built, and it all starts with a process called validation. And here it is, the official name, Analytical Method Validation, or AMV for short. And you've got to understand, this isn't just some friendly suggestion. It is the absolute bedrock of quality control in the pharmaceutical world. It's literally how we prove that our lab tests are giving us the right answers. This analogy right here just nails it. You wouldn't use a rusty, beat-up ruler to measure a microchip, would you? Of course not. And it's the same idea in pharma. You can't just grab any old test off the shelf and hope for the best. When someone's health is on the line, you have to prove, beyond a shadow of a doubt, that your measuring tool is perfect for the job. And believe me, this isn't optional. Regulatory bodies all over the world, like the FDA in the US and the EMA in Europe, make this mandatory. They require that every single method used to test a drug is validated from top to bottom. And why? Well, because patient safety is everything. There's just zero room for error. Okay, so what exactly are we talking about here? What falls under this giant validation umbrella? Let's take a look at the blueprint, what actually gets put to the test. We're actually looking at a whole battery of tests. First, you've got identification. Is this even the right drug? Then there's assay. Is it the right strength, the right dose? Super important. Purity checks for any nasty stuff, any impurities that shouldn't be in there. And finally, dissolution. This one's cool. It asks, will your body actually be able to absorb this thing correctly? Every single one of these questions needs its own carefully validated test method. So now we're getting to the real heart of it. How do you actually prove a test is reliable? Well, you do it by putting that test through its paces, checking it against a very specific set of characteristics. This is the method's proving ground. And here they are. There are 7 key validation parameters that, when you put them all together, give you a complete, crystal clear picture of how well a method performs. Think of it as the ultimate quality checklist for the test itself. Let's break these down one by one, because each one tells us something crucial. First up is specificity. And honestly, this one's a huge deal. Specificity proves that the test can find and measure the one thing it's supposed to be looking for. You know, the active ingredient, while completely ignoring everything else. We're talking fillers, coatings, or even teeny tiny impurities. It's all about getting a perfectly clear signal through all that background noise. All right, next up are 2 terms that get mixed up all the time: accuracy and precision. This target here illustrates the difference perfectly. See, accuracy is all about hitting the bullseye, getting as close as possible to the true correct value. Precision, on the other hand, is about consistency. It's about hitting the exact same spot over and over and over again, even if that spot isn't the bullseye. A truly great method? It has to do both. It has to be accurate and precise. And we really put precision to the test, you know? We check for what's called repeatability, which is running the test under the exact same conditions. But then we throw it a curveball. We check for intermediate precision by deliberately changing things up. We'll have a different lab tech run it on a different piece of equipment, maybe even on a different day. This makes sure the method is consistently reliable in a real world, not so perfect lab environment. Next, we have linearity and range, and these two really go hand in hand. Linearity proves that the test's response is proportional. So if you double the amount of the drug, the test results should also double. It should give you a nice, predictable straight line on a graph. And the range? That's simply the span of concentrations from the lowest to the highest, where we've proven that straight line relationship is solid. Okay, this next one is absolutely critical for safety. We're talking about the detection limit, or DL, and the quantitation limit, or QL. Think of it this way. The detection limit is the lowest amount where you can just barely see that something is there. It's a whisper. But the quantitation limit is the lowest amount you can confidently and accurately measure. When you're tracking potentially harmful impurities, just knowing something is there isn't good enough. You need to know exactly how much. That's why QL is so important. And last but not least, we have robustness. Let's be real, labs aren't perfect vacuums. The temperature might drift a little bit, or the pH of a solution might be a fraction off. A robust method is one that can handle these small, deliberate, real-world changes and still give you the right answer. Basically, a robust method is a reliable method, day in and day out. So, after all 7 of these parameters have been tested and the method has passed with flying colors, what happens next? Well, all of this data gets pulled together to create the final, undeniable stamp of approval. Every single piece of data, every graph, every result from all these tests gets compiled into a huge, comprehensive document called a validation report. This report is the definitive proof. It's what gets submitted to the regulatory agencies, and it becomes the official record that says, yes, this test method is valid, it's reliable, and it's absolutely fit for its intended purpose. And that brings us right back to where we started. So what's the secret to trusting your medicine? It's not a slogan, it's not a brand name, it's not a promise. It's documented scientific proof. It's this incredibly thorough process that validates every single test, ensuring that what's on the label is exactly what's in that bottle. Because in the world of medicine, trust isn't just given. It is meticulously earned through proof.